than 30,000 people in the United States will be diagnosed with multiple myeloma this year. But as science advances, cancer experts are exploring potential ways to work directly with the body's immune system to help fight this disease. And here to help us understand multiple myeloma a little better is hematologist and oncologist Dr. James Berenson. It's great having you, sir.
Thank you for having me.
So explain, first of all, what multiple myeloma is, who it affects.
Multiple myeloma is a bone marrow-based cancer. It primarily affects the elderly. The average age is 69, but I've seen patients as young as 20, as old as 100.
Wow.
It's more common in African Americans and slightly more common in men than women.
And the fact that the body's immune system up until now really hasn't been fighting myeloma like this, how are we able to harness now the immune system to try to have it fight it?
Great question. So we know the immune system is used to fend off bacterial and viral infections. And we also know that cancer patients, especially myeloma patients, have impaired immune systems. But now what we're able to do is with these new drugs, we can trick the immune system, boosting its ability to get rid of the myeloma. And that advance is very new. Just in the last couple of years, there's a couple of new drugs that can do that.
Absolutely. I mean, obviously, data is... knowledge is power. Data just came from the European Hematology Association. What was found, and what does this mean for the multiple myeloma community?
Well, as a clinical researcher, I've led clinical trials with a drug called Implicity, and that drug, when combined with Revlimid and dexamethasone, has been shown to extend the time during which the patients are doing well. We now have 4-year data way out there now showing that when you add this drug to Revlimid and dexamethasone, the old guard used to treat myeloma, it extends the time during which the patients are doing well. Now, like all drugs, it can have side effects, so occasionally patients can have an infusion reaction to Implicity, and with the other drugs, they can have liver problems, infections, and occasionally secondary cancers. The drug, because of this really promising data, is now approved. That is Implicity with Revlimid and dexamethasone, not as first treatment for myeloma, but among patients who've seen 1, 2, or 3 prior different treatments for treating their myeloma.
Absolutely, of course. I mean, if you are under the gun with myeloma, you want to make sure that you're throwing everything you got at it. So this is a great opportunity to do so. What is the community, the myeloma community, saying about this? They must be overjoyed by something like this.
Well, I think we're overjoyed not only by the fact we have a new drug, but we have a new drug that's safe and well tolerated. In the past, we've used a lot of agents that have made people sick, really reducing their quality of life and impacting actually their length of life with their reduction in quality of life. Now with new drugs like Implicity, with their good tolerability, we can give treatment in which patients can go about their normal daily activities and feel good.
Absolutely. If patients or caregivers want to get more information, where do they go?
They can go to Implicity.com to learn more about this drug, Implicity, as well as how it's used and its side effects. And if you want to learn more about myeloma in general, you can go to imbcr.org.
Absolutely. Obviously, a lot of information there, a lot to take in. We'll make sure we study up on this. Doctor, it's a pleasure having you. Thank you so much.
Thank you.
All right, if you want more information on the treatment options and more on multiple myeloma, the website's right there on your screen. Implicity, it ends in an I.com is the website. Bristol Myers Squibb, proud sponsor of the Morning Blend.